Hi, I'm James Ofsink, and I want to talk to you today about healthcare and specifically why I support developing a universal healthcare system to ensure access to all Oregonians. We live in the richest country in the history of the world, and yet we are the only developed nation on the planet that does not ensure universal access to healthcare for everyone who lives here. And the human and economic results of this are disastrous. An estimated 45,000 Americans per year die from treatable illnesses and ailments simply because they could not afford the health care that they needed at the time that they needed it. That is unconscionable to me. And then furthermore, an estimated 700,000 Americans, more Americans than live in the city of Portland, declare medical bankruptcy every year. These are people who will not be able to take out a mortgage in order to purchase a house, who will not be able to get a loan to start a small business, simply because when they got sick, they were either underinsured or did not have enough money in their pocket to afford the treatment that they needed. That is a terrible outcome for our system. So the system has gotten a lot better since the Affordable Care Act, Obamacare. We have removed many of the most egregious abuses of our old system, but there are still a lot of areas for improvement. For instance, universal care as a whole. There are still a lot of people who don't end up purchasing insurance under the Affordable Care Act, or even if they do purchase insurance, they end up being underinsured, not realizing with the mishmash of different providers that are offering all different tiers of plans, what is going to be the most appropriate health care for their needs. Then the second thing, the second reason why I really think that we should go to a single payer system is our economy is changing, and people have, especially young people, have more and more jobs throughout their careers. And those could be jobs in serial where they do 2 to 5 years at one employer and then move to another one, or it could be an increasing share of our economy that are putting together a bunch of part-time work to create a full-time living situation. If that's 10 hours, 10 hours, 10 hours, 10 hours, then it's very unlikely that those 4 different employers are going to be providing health insurance, even though the employee is working full-time or full-time plus and still not receiving health insurance through their employer, and in many cases not purchasing it out of pocket. So those people end up receiving treatment or having to purchase insurance at the most expensive time, after they've already gotten ill and have tried to recover by sleeping it off or taking over-the-counter medications, and now at the most expensive time are coming into the healthcare system and are at huge risk, both in terms of health outcomes and in terms of just being charged a tremendous amount, either personally or to the system, in order to make them healthy again. Then the last thing that I want to touch on today is the preventative aspects. When we have a single payer system, then there is a sense of the patient is going to be in the system from birth to death. So all the way through, somebody is looking out for what is going to keep this person healthy. In our current system, since the average patient will stay on an insurer for on an average less than 6 years, it means that each insurer is kind of hoping, how do I not provide insurance to that person at the time they get sick? If that is by denying claims, or if that is by taking a long time to pay out, or if that is by making sure that the contracts are written such that many things aren't covered. The incentive for each insurer, of course, is to not pay out. They call it medical loss when they're actually paying for the care for people to get better. That is a loss, because when they're not paying that, it's all profit to the insurer. So we want to have a system that will make sure that we are administering preventative care when it's cheapest. We do not want to wait until the end when people are sick or very sick, close to death, when it is most expensive and of course most terrible for the patient to make them healthy. So those are kind of 3 reasons why I think that we should be moving to a single payer system, why I support the efforts of Healthcare for All Oregon and other groups that have been working on this, and why I believe that we need to invest now. And I will help champion the charge in the Senate to invest now in creating a single payer system that will help keep a healthy Oregon into the future.